Children of Aging Parents, or ACAP. My name is Bruce McReynolds, and I, along with Ashlyn Martin, serve as co-chapter coordinators of Adult Children of Aging Parents here in Guilford County. On behalf of ACAP Guilford County's leadership team, we'd like to welcome you to tonight's program entitled Overview of Prevalent Age-Related Health and Medical Conditions. ACAP Guilford County programs are presented the third Thursday of each month at 7 p.m. So we'd like to invite you to our upcoming events to check those out and see what's coming up on the horizon. You can go to ACAP Community's website at acapcommunity.org. There you'll see our upcoming presentations, and you can also see our past ones by visiting our YouTube channel. Going to YouTube, you can search for ACAP Community, and you'll see all of our past programs as well as many podcasts. So we hope that you'll join us for our upcoming programs on Thursday, November 18th. The topic will be what to look for when visiting mom and dad. Then coming up in December on the 16th, we'll focus on caregiver compassion fatigue. So ACAP presents, has a really special symposium presentation coming up that we want to make sure that you're aware of. ACAP Communities presenting Caring and Coping When a Loved One Has Dementia. It's going to be on Friday, November 5th from 1 to 4:15. That's Eastern Time. And we're very excited that Teepa Snow, a world-renowned dementia expert, is the program speaker. Registration is required, but there's no cost to attend. The virtual symposium is offered via the Zoom platform. So definitely you'll want to mark your calendars for November 5th and plan to be part of that symposium presentation by Teepa Snow. For more information or how to register for the symposium or to learn more about ACAP, its programs, and its local chapters, you can go to acapcommunity.org. So in order to view our programming or to bring our programming to you at no cost, we have some really great organizations that have stepped up to sponsor our activities and monthly programs. In Guilford County, our annual sponsors that make our chapter activities possible include two core sponsors, which is Providence Place and Griswold Home Care, and then one special chapter sponsor, Mount Zion Baptist Church. But tonight's program is being sponsored by Home Instead. The comfort of home can't be beat. Home care services allow people to flourish in the everyday life they already know and love, while getting a little help to stay independent and mobile. Home Instead's care services help to enhance the aging experience by providing practical support at home with the human touch. Their professional caregivers assist older adults with common activities of daily living, as well as assistance with meal preparation, errands, and other household services that build long-lasting relationships with the families they serve. Home Instead's personalized care plans help lift the caregiving burden from family members to keep those strong family bonds intact. The Home Instead office in Guilford County has been serving older adults in this area for over 21 years. Each Home Instead office is independently owned and operated and is part of an international franchise network of over 1,200 offices worldwide. Our mission is to improve the lives of seniors and their families everywhere. So thank you, Home Instead, for sponsoring our program this evening. So let's jump into the topic of tonight's program, overview of prevalent age-related conditions. We're all living longer, and as we age, we are more likely to experience one or more significant health and medical conditions. Some conditions are prevalent as we age. For example, some types of cancers, diabetes, cardiac and pulmonary issues, strokes, as well as Alzheimer's, Parkinson's, and other neurological conditions. Our speakers this evening will help us to understand the most prevalent conditions associated with aging and to recognize risk factors and typical symptoms, as well as offer strategies for adult child caregivers who are helping manage health and medical conditions with their parents. So we're delighted to have two experts with us this evening, Tracey Ennis. Tracey is a community and hospital liaison with AuthoraCare Collective, formerly Hospice and Palliative Care of Greensboro, and Hospice and Palliative Care of Alamance and Caswell counties. The name AuthoraCare was born when two organizations merged and supports the mission. Patients are always the author of their life story. Tracey is honored and humbled to be part of the collective team that supports patients and families to author more moments that matter, regardless of their stage of their illness or condition. Daily, she has supportive and helpful conversations with patients and their families, attempting to make appropriate, either serious or end of life or illness decisions. Often in their personal life, Tracey is sought out by individuals and families seeking to do the same thing. Tracey completed her Bachelor's of Science degree in 1991 at Oregon Health Sciences University. She has the blessing of many professional experiences, including working with Gastrointestinal Procedural Center, Labor and Delivery, Critical Care, and the Emergency Department. Tracey shares that her heart is drawn to helping others live their life well, especially those facing serious illness and end of life. We're also blessed to have Kevin Pearce with us this evening. He has a master's in divinity, a chaplain and bereavement counselor for over 25 years. He is now a community liaison with AuthoraCare Collective, formerly Hospice and Palliative Care, where he educates, empowers providers, facilities, and the public to understand how to face serious illnesses and obtain the best end-of-life care. He recently experienced hospice care firsthand for his father and his father-in-law. So with that, I'm going to turn the time over to Kevin, and he can start things off for us.
Thanks, Bruce. Thank you very much. And thank you, Griswold Home Care. Thank you, ACAP of Guilford County. And thank you, Home Instead, for the opportunity for AuthoraCare to present tonight on some of the more common or prevalent age-related illnesses and conditions that our loved ones may experience as they age, and hopefully some information about what we as children can do. And I say we because my 92-year-old mother is in a independent living facility in another state. She has several ongoing conditions that she's wrestling with. She lost some significant hearing loss, along with a significant lung impairment. So I understand firsthand, as many of you do, what it's like to love our elderly parents and to go with them on this journey that they are on. It's quite a challenge. So I appreciate your presence here tonight. As Bruce mentioned, I also experienced hospice care for my dad 4 years ago, for my father-in-law 2 years ago. So understand that, and I think those experiences probably make me more of an expert than any of the years almost that I've spent in this care, because there's nothing like firsthand experience to help you understand what it's really like. And I know that you guys, as out there, adult children, know that very, very well. Wanted to introduce Tracey. I'm extremely privileged to be on her team and to work with her every day. I see what she does. What we want to do tonight, as she goes over these health and medical conditions, is to have you ask us questions. I'm going to stop Tracey and ask her questions about things I don't understand or things I want to know more about or things that hit me in such a way that I think, boy, I sure would like for her to expand on that. So hopefully she won't get too upset with me and throw something at me through the screens. But we want to have a conversation and we want you to put your questions. We want you to be a part of that conversation. Please put your questions in the chat, send them to Bruce. Bruce will get them to us and we will answer them as best we can. So Tracey, I'm going to let you get started.
Well, good evening, everybody, and thank you for the honor and the privilege of being able to share a little bit of information about prevalent age-related health and medical conditions. As Kevin said, we do want this to very much be a conversation. So we've prepared a slideshow, more than happy to toss that out, but also willing to present that information and then stop us if there's additional questions or concerns, things that apply to you personally or to others that you know are dealing with aging parents. So with that, we're going to go ahead and get started. So getting older can seem daunting and certainly isn't for the faint of heart. Graying hair, wrinkles, forgetting where you park the car. All jokes aside, aging does bring about unique health challenges. Seniors account for 12% of the world's population, increasing to over 22% by the year 2050. There are many chronic health conditions, and according to the National Council on Aging, 92% of seniors have at least one chronic disease, and 77% have at least two.
Tracey, let me stop you right there. That is astounding to think about. And Bruce touched on this in his introduction. So you are saying that 77%, over 3/4 of senior adults have more than one chronic illness that they're wrestling with right now?
That is very true, very true. And those can include heart disease, stroke, cancer, diabetes. Those are among the most common and costly chronic health conditions that are causing 2/3 of deaths each year. There are many others that we haven't necessarily outlined, but we can certainly talk about if others have questions.
That's got to make it more complicated when a senior is dealing with more than one illness at the same time, and especially for those who are caring for him.
Absolutely. It can involve many different healthcare providers, which can then bring about challenges in connecting all of those dots. And we're going to talk a little bit about that further, about how you can pull all those people together.
Got it.
So we're going to focus on heart disease now. It is the #1 cause of death in women in the U.S. The most common type of heart disease in seniors is atherosclerosis, which is simply a buildup of fatty deposits and plaques in the wall of the arteries. Depending on where that accumulation is in the body, the blockage can disrupt flow of blood and oxygen and lead to a heart attack or stroke. Atherosclerosis is not a normal part of aging, but maintaining a healthy lifestyle is the best prevention, which includes physical activity in your daily routine, eating a healthy diet, not smoking, managing stress, and getting enough sleep.
And I'm assuming, Tracey, that for those seniors who are wrestling with heart disease, for them to not get a good night's sleep is going to impact their heart disease as well. It'll show up in a lot of places.
Tremendously, especially in stress, just so many different impacts if they're not getting a good diet, all the things that we just outlined.
Gotcha.
Diabetes. So more than 1/4 of adults over the age of 65 have diabetes, either type 1 or type 2. And approximately 1/2 of older adults have prediabetes. Diabetes requires a significant amount of self-care, which can be difficult for older patients to manage independently.
And when we were putting this together and we talked about this, tell me a little bit about how that impacts seniors in particular if they're managing diabetes.
Well, it's difficult to manage. Oftentimes, if you've got diabetes, you're being requested to check your blood sugars. And so, with decreasing eyesight, which we'll talk a little bit further about, it can be difficult to know exactly where to poke your finger. It'll be difficult to necessarily get that blood placed on that blood sugar strip so that they can see. It's difficult to necessarily read the numbers that might be on that strip. And then if they're taking oral medication, that might be a little bit easier. But oftentimes, as we talked about with many chronic health conditions, you have more than one medication. So making sure that you're choosing the right medication, or if you're having to manage insulin, those are very small syringes trying to draw up the proper amount when you have limited eyesight, and then getting that injected into the right area.
Yeah, that makes sense. Wow.
Transitions from the hospital with diabetes to home can be very risky for those same reasons. Patients come home, they may have a new diabetic regimen prescribed to them, but maybe they haven't had enough time to really see how is that diabetic regimen going to work for them when they arrive home. And so they may have a lot of dosing fluctuations. They may have highs that they're not responding to, or they may have lows. And then who do they reach out to? Who do they say, this is what's going on? And so it's a very risky time for those patients when they're coming home.
So it's almost essential for an adult child to accompany the senior to the hospital, knowing full well that they may come home with a whole new diabetic regimen.
It would be very helpful to have somebody there to be that additional pair of eyes and ears, be able to see and witness what's happening for that aging adult who may not be aware of some of the symptoms that they're experiencing if they're having those fluctuations.
Gotcha.
One of the important things also is regular foot examinations. You go to visit mom or dad, make sure that you're taking a look at their feet. It's so important with diabetes. Oftentimes, patients have neuropathy, which means they have decreased feeling in their feet. And so they may not be aware that they have actually sustained some sort of injury, which can lead to further infections or ulcers. So make it part of a habit of when you're visiting mom or dad, taking a look at those feet and seeing what's going on. And then if you can, get them out. And regular walking can improve the circulation, which improves the blood flow to those feet and helping with healing or preventing ulcers in the first place.
Gotcha. I'm aware of seniors who have clipped their toenails too close and had a bleeding incident. Not aware of it. It becomes worse. I mean, worst case scenarios that can lead to infection and even worse infections.
Absolutely. Yeah. So again, just having another pair of eyes, because as you're aging, sometimes those aging eyes don't always see that. And then if you've got diabetes complicating it, they may not always feel that.
Gotcha.
So in management of chronic health conditions, it's important to meet with your physician for regular annual checkups, maintain a healthy diet, and keep an exercise program to help manage or prevent chronic diseases. Loss of muscle mass as we age and increase in fat mass may contribute to how many medications work within the body. And so they're oftentimes prescribed medications, but we don't consider as we continue to age that we might need to lower the dose of those medications. Maybe they're working, being taken up in the body more and having a greater impact on that body, which the body doesn't need. And so maybe having more side effects rather than they are doing good for that patient.
That was fascinating to think that older adults may need lower doses of medication, according to your presentation, because of that very reason. They've lost muscle mass, they've got increased fat mass, and their bodies just don't work the way that younger bodies do, if I'm hearing you correctly.
Absolutely. Very true. Yeah. Okay. So just something to manage and continue to have considerations with and conversations with your primary care provider.
Great. Got it.
So we're going to move on to cancer. The second leading cause of death in older adults is the second leading cause of death in older adults is cancer. But most of the time, those are the most common are slow-growing tumors. The response to cancer treatments depends more on functional status rather than age. Individuals should not be denied aggressive cancer treatment simply due to age.
Talk about what that means, Tracey, if you would.
Yeah, most certainly. So you could be 80 years old and running circles around me. I certainly wouldn't want to deny that person the opportunity to have their cancer workup and consider cancer treatment if they are living a full, vibrant life. But if you've got somebody who has a lot of chronic conditions and then they have been diagnosed with cancer, even though they may be 65 years old, if they're not living a quality life and they're having a lot of other health conditions and complications, you might want to consider what would the toll of that cancer treatment involve, and is that really quality living for that adult,
In
for that
hospice,
senior adult?
and in hospice care, palliative care, which we're both a part of, we talk about benefits versus burdens. Is that
Absolutely. Yes, very important. And we're going to hit on hospice care and palliative care a little bit further into this conversation.
okay?
So we're going to talk about the most common types of cancer right now affecting older adults. Breast cancer is one of the most common cancers in people over the age of 60. The best way to detect breast cancers is yearly mammograms. Prostate cancer, common diagnosis in men over the age of 65. The best way to detect is through a blood test that looks for specific antigens. And then also on the physical exam, also checking for prostate issues. Colon cancer, more than half of the people who get colon cancer are at least 67 years of age. The best way to detect colon cancer is through a colonoscopy. Lung cancers, more than half of the people who get lung cancer are over age 70. Routine screening is not recommended unless you smoke or you have smoked for more than 30 years before quitting. CT scans are used to detect lung cancer. And bladder cancers, more than half of the people with bladder cancer are over age 65. There's no recommended routine screenings, but it's very important to watch for blood in the urine, paying attention to if you're having to urinate more often, any painful urination, urgency, which means you needing to go quite frequently, or having difficulty with urinating in weak streams.
So this is scary, Tracey. All these different types of cancer. And the increased percentages that senior adults are subject to. What do you recommend? And I'm teeing this up for you about the screenings. So talk about that a lot.
So screening should only be recommended in cases where there's a long predicted life expectancy and perceived strong capacity to tolerate cancer treatments. So what I mean by that is that, again, if you're, like the American Academy of Gastrointestinal Physicians recommends that, routine screenings stop at around the age of 70, 75. But if you have a vibrant 70, 75-year-old who has no serious chronic conditions that anticipate that you would be ending life anywhere in the near future, and specifically in the next 10 years, you would want to offer them the opportunity to continue routine screenings for cancer, because the anticipation would be that if we were to find something on a routine screening, then they would likely be able to withstand some sort of treatment, including surgery, chemotherapy, or radiation. But again, taking that frail person who may have a lot of chronic health conditions, would you want to put them through a screening only to worry about or not be offered the opportunity for treatment for that cancer, and then take away from the quality of life that they might have because that treatment can not be offered to that patient? So you really have to look at what is the lifestyle for that patient. What are they capable of doing? Do we anticipate they're healthy and we think that things could go well for the next 10 years, or this is a really frail patient and things are not going well, and maybe it's best just not to look and let things be.
So it's important to tailor it specifically. And of course, as we talk, we're going to encourage folks to go back to their primary care physician to have those conversations, but to keep in mind, who is my loved one? What kind of situation are they in? And what is most appropriate for them in their situation, if I'm hearing you correctly.
Absolutely. And then we will also talk about what are their wishes? You know, we might have our opinion about what their lifestyle is like or how their life is, but it's important to include them and what their desires and their wishes are for their future.
Got it. Okay.
So let's focus a little bit on cognitive health now. So mild short-term memory loss, word finding difficulty, slower processing speed are all normal parts of aging that are often noticeable by the age of 85, sometimes earlier. Changes from normal brain aging can affect driving safety and increase the risk for financial exploitation. These changes can also make it difficult to understand complicated medical information. Brain aging does not happen at a uniform rate. Genetic and social factors like education and occupation may be protective. And most common cognitive health issue facing the elderly today is dementia, which is the loss of these cognitive functions. Approximately 47.5 million people worldwide have dementia, and the number is predicted to nearly triple in size by 2050. That's significant. The most common form of dementia is Alzheimer's disease. So there's an umbrella of dementia with multiple different factors that fall under, and dementia is one of them.
Okay.
Women make up almost 2/3 of all diagnosed dementia cases.
Wow.
The most common symptoms are forgetting recently learned information, repeatedly asking for the same information, relying on memory aids as a crutch, asking family members to assist with tasks that were normally able to be handled, and confusion about time and place.
And as so it's not just when we can't remember the name of that thing or that name of that person, and it can scare us as we think, my goodness, what's happening to my memory? But I've heard it's much more similar to all of a sudden, if I start placing my car keys in the refrigerator, or if I open a checkbook and have no idea what that is for or how to use it, those are much more closely associated with the possibility of significant dementia issues.
Yes, absolutely. Common tasks, leaving the stove on and forgetting that you've, placed dinner on there to heat up, or
Not just common forgetting, but major kinds of things in terms of cognitive.
right, things that, again, they knew what they were doing prior, and now all of a sudden seem to kind of be, missing those
At a loss.
faculties. Yes,
At a loss, a complete loss.
absolutely.
Yeah. Okay.
So the National Institute on Aging, chronic health conditions and diseases can increase the risk of developing dementia. Substance abuse, diabetes, hypertension, depression, HIV, and smoking all are things that can add to increasing the risk for developing dementia. Screenings may have limited clinical benefit because medications are only marginally effective. However, screenings have a major public health benefit and a personal health benefit. Many adults living with dementia have unmet needs and may be living or driving unsafely.
And I was going to ask you to talk a little bit more about that marginally effective, because we see commercials all day long on TV about the medications that are recommended. Can you talk a little bit more about marginally effective?
So unfortunately, we do see that there are medications that may prove to have some benefit, but it really kind of depends on when that medication is introduced. It may be beneficial if cognitive development is delayed and caught early. It may have some protective benefit, but as the disease, it does not cure. There's no cure with these medications. But as the disease advances and progresses, then unfortunately, we find that the medicines are even less and less effective, and the disease is going to progress
So the earlier,
as time goes on.
right. So the earlier, the better in terms of seeing significant effects of some of the medications.
Absolutely. And also being willing to understand that as the disease gets much more progressive, that medication may not be beneficial, oftentimes can be costly, and oftentimes is maybe causing more adverse effects than it is bringing about benefit.
That's helpful. That's not easy to hear, but is very helpful to think about as we seek to provide the best care and best decisions for our loved ones.
Most definitely. So in mental health, we oftentimes see grief with our aging adults, and grief is a normal response to life events. Specifically, as we age, we start losing more friends. We may be losing family. We have the loss of our jobs and how we identify with who we are, loss of income. And then if you're experiencing multiple chronic conditions, then you may be having loss of physical, social, or cognitive functions from illness. Common mental disorder among seniors is depression, and that occurs in at least 7% of the elderly population.
And if I could again share a little bit about from my own personal experience, she's okay with me sharing this information. But my mom suffers from Meniere's disease, which is a hearing loss, a significant hearing loss issue. And it's been extremely difficult for her to adapt to that. She was a very active person. She was worked in offices, kind of ran the office. Whether she was the boss or not, she often ran the office anyway. But she prided herself on being able to be competent, and it has been extremely difficult for her not to be able to hear, not to be able to participate in conversations like she used to. And I think I see depression, and she's been diagnosed with depression because of the fact that she's lost that ability and can't do what she used to do.
And we're going to talk a little bit more about things that might contribute to helping her to hear better, difficult with Meniere's disease. But yes, depression is significant and oftentimes underdiagnosed and undertreated. It accounts for over 18% of suicide deaths here in the US alone. And depression can be a side effect of chronic health conditions like you're sharing, Kevin, Meniere's disease. And managing those conditions as best you can with your primary care provider can help. Depression is even more common among institutionalized older adults and those with disabilities. So we oftentimes see people that, it's best to place them in a facility for their safety, and we think for their socialization, but oftentimes we can miss the fact that has been a significant change for that individual. And even though it's best, it may lead to depression.
It's a big change for them to lose what they know, lose their homes, lose the familiarity of all that, even though, like you say, that may be the absolute best decision for them in terms of safety. So hopefully in those situations, they're able to become in the facility. That I know they work very hard about helping folks make connections, build relationships. They have numerous activities. They work very hard at helping folks make that transition. But I'm hearing you say that it's a tough one. It's not easy to do that, even though it may be the most appropriate one for adults.
Absolutely. And it is very difficult. And then, of course, with the COVID pandemic, we have all known that we've even become more isolated. We've kept our older adults who need that socialization and maybe making those changes during the pandemic, being isolated to their rooms, but then also being isolated and significant change from families and what they've always known.
Yes, we've seen that. We also I hear family members who go back to their loved ones after having not been able to see them and see significant changes, like you talk about, because of the fact that not only are they outside of their home environment, but they've been isolated within the facility. Sometimes they were not even allowed to leave their room for some periods of time. So again, that takes a big toll on those folks. And I hear adult children talk about the changes they have seen in their loved ones.
So it's important very much to bring that forward to the people that are caring for them, for maybe the provider in the facility, or for them to speak with the primary care physician. aggressively approaching your concerns for that loved one to diagnosis and treatment help minimize suffering. They improve overall functioning, prevent suicide. It's important to increase the social support from family, if at all possible, friends and support groups. If you have concerns while they're in an institution, or even if they're at home, if you can try to find a way to involve them in some sort of social outlet.
Okay. And Tracey, when you say aggressive approaches to diagnosis and treatment, tell me a little bit about what that looks like.
Having those very candid conversations. If you're concerned, talk to the people that are around them, either in the facility that can make a difference, either that primary care provider or that director of nursing, that lead nursing head nurse that may be there, a physician or a primary care physician. They aren't oftentimes able to see in a brief moment during a doctor's office visit or stopping by to visit that resident in a facility to recognize that maybe this is something that's going on. But the staff or the family that are there more frequently and seeing that that patient is not who they used to be, or that they're more withdrawn, they're not interested in participating in activities, recognizing that early recognition and then speaking out and asking for help. And oftentimes medications will be prescribed, and we have this stigma with psychological or depression specifically. We think we're supposed to pick ourselves up by the bootstraps, but depression is no different than having diabetes. It's not something we necessarily can control. We can't flip the switch on and we can't flip the switch off. It's a chemical imbalance in our brains. And so it's very important to recognize that it's equally possible to treat like diabetes, that you may need medications, and it's not something that you decided you wanted to have diabetes one day and then didn't. But certainly by treating depression with the medications may be very helpful and beneficial to that older adult.
Yeah. There's a real biological component to it. And our
Absolutely.
role as adult children, again, is advocates.
Advocacy.
Okay.
Absolutely. So physical injury is the next topic we're going to talk about. Every 15 seconds, unfortunately, an older adult arrives in the emergency room for a fall. Aging causes bones to shrink in size and density, and muscles to lose strength and flexibility. Other factors that can contribute to falls are eye and ears disorders, like you were talking about, Kevin, with Meniere's, medication interactions, numbness, which might be related to just aging, could be related to diabetes, joint pain, such as arthritis, and we're going to talk about that in a few moments, and dizziness. Seniors are much more susceptible to losing their balance, having significant bruising, and fracturing bones.
And of course, I know my mom has been prescribed a rollator, which she does not like. And she also, and we're about to make a short trip over the weekend. And of course, she didn't want to take it with us. She doesn't want to take that. But I'm hearing you say that it's extremely important for her to have that, especially with the combination of her age, the other, her weakness, her decreased strength, and on top of that, her hearing loss.
Most definitely. And just trying to appeal to it, it is difficult. They say, I had a dear loved one that was using a walker, and he's like, I don't need that. That's for old people. Well, he was, 91. It was okay, but he didn't see himself as 91. But trying to appeal to the fact that though this may not be what you want to do, or you feel like it's compromising you as a person, it would be much more of a compromise to end up in the hospital with a broken bone, end up in a facility that you don't want to be in. This is giving you that freedom. But it is difficult, and it is a huge change and loss of who we have been as independent adults. Okay. So 2 diseases that contribute to frailty and falls: osteoporosis and osteoarthritis. Almost half of all adults age 65 or older suffer from arthritis. It is the nation's #1 cause of disability and can be a source of acute pain and impact quality of life. Because it can discourage seniors from physical activity, it's important to work with their doctor to manage that pain and control discomfort. And osteoporosis is estimated that over 2 million bones are fractured due to osteoporosis every year in the US. And women are at much higher risk due to loss of estrogen as they age. In the 5 to 7 years after menopause, women can lose up to 20% of their bone density. And I'm going to go a little bit faster, recognizing time here. So it's important to get adequate amounts of calcium. And I've listed out the recommendations here for the amount of calcium. Slideshow is certainly available to anybody who may need it. For vestibular dysfunction, which is what you're talking about, Kevin, with Meniere's, can cause dizziness and often caused by many factors that can contribute to falls. And there are vestibular rehabilitation programs that can help. And they are not inpatient programs. They're simple things that can be done at home, but really can make a significant difference. Many cases of falls can be prevented through education, increased physical activity, and then practical modifications in the home, making sure you don't have rugs laying around, throw rugs laying around, making sure cords are picked up, making sure pets, if they're small pets, that hopefully your loved one can pay attention to those pets and navigate around them, or even considering whether or not that's best for them in the home.
Those are significant trip hazards for seniors.
Absolutely. So we're going to talk a little bit about HIV and AIDS. It's an important thing to talk about because with medications, we're seeing people with the diagnosis of HIV living much longer. With that, though, older people with HIV are facing greater social isolation and loneliness and stigma. Therefore, they don't always want to talk about the fact that maybe they are dealing with this diagnosis and that they've been dealing with this diagnosis. It is important for older people with HIV to have access to mental health and other support services. One of the things with aging is that we may be losing our lifelong spouse, and then we are left alone, but no one's meant to be in life alone. And we want people to be reaching out and developing relationships and having intimacy with other adults. The problem with that is that if you are HIV positive, you might not share that with a new loved one. So it's very important to, if you can, have that conversation with your senior adult, that they need to be practicing safe sex if they're sexually active, and or finding other ways to have intimacy.
It's often awkward for us as adult children to raise that topic, but I hear you saying it's extremely important and can be a very important part of their lives, even into their older years.
And for others' lives and protecting other people. It's conversations that I've had with people. Yeah, none of us ever want to think that our parents had sex, but they did. We're all here as a product of that. And the best conversation, or the best item that I think I've ever seen is a birthday card that talked about, it was a happy birthday card that said, "Happy proof your parents had sex day." So it's important to, it's a normal part of our lives. We want everyone to be experiencing that if that's important to them, but absolutely practicing safe sex and being able to have those open conversations and realize that there doesn't need to be a stigma attached to that, but it certainly needs to be a safe environment so that they can continue to seek the treatment that they need and protect others if they're choosing to be intimate.
And ultimately, relationships are still extremely important for seniors.
Most important. Gotcha. We certainly don't want that social isolation if they're dealing with something along with HIV or any sexually transmitted disease. So malnutrition is the next subject we're going to talk about. It's often underdiagnosed and can lead to other significant health issues, such as a weakened immune system and muscle weakness. It can stem from other health issues that are going on, such as dementia. They just may forget to eat. Oftentimes as you're aging, you don't have that same hunger and thirst sensation. It may be subject to depression. It may deal with alcoholism or have other dietary restrictions, and so they just don't think food tastes good. And then having reduced social contact, oftentimes, we all experience that, when we're connecting socially, it's oftentimes around food. And then certainly limited income when people are choosing to put food on the table or pay their lights or have a place to live. they may choose to separate from food.
I see seniors with decreased intake oftentimes, many times, and especially also have struggling to drink enough fluids.
Most definitely. They just don't have those sensations, and it's difficult to get them to understand or realize that it's still important to continue that intake. Sensory impairments. It's extremely common for older adults over the age of 70 who might have difficulty focusing on objects that are close up. They may become more sensitive to glare, which makes night driving much more risky. Have difficulty adjusting to different level of lights. And aging can also affect the eyes, causing clouded vision. Consider joining your loved one for outings and encouraging daytime outings rather than evening outings. Hearing may diminish, and having difficulty hearing in high frequencies is very common, and following a difficult conversation in a crowded room. As we age, we can have increased earwax production that contributes to difficulty hearing. So when you take your loved one, or when your loved one goes in for a physical exam, ask them to make sure that their doctor checks their ears if they're having difficulty hearing. It can be something simply as cleaning out that increased earwax. Make sure you're talking slow. Try to limit the multiple people in a large room talking all at once, and turn off any other distractions if you can at all possibly do so. Make sure you're scheduling regular checkups. Take precautions now and as for your loved one, such as wearing sunglasses or wide-brimmed hats, using earplugs around loud machinery or any other loud noises. These conditions are often treatable by aids. It's important, though, to recognize that oftentimes insurance doesn't cover these, and they can be quite cost prohibitive. So making sure that you are looking at either speaking to a certified Medicare agent or the State Health Insurance Assistant Program to talk about Medicare options. They can specifically look at each individual. Just because your plan is working great for possibly you, Kevin, it might not work great for me, because we're two different individuals and our health conditions completely dictate what Medicare plan we should be on. Your plan might be great for you because of the medications you're on and the health conditions you might be experiencing, but it's not great for me because my conditions are completely different. But speaking to somebody who's certified, or speaking to a state health insurance program person who's certified, they can look at each of those individual things, look at either no cost for having that insurance policy and then paying for it if you need it, or paying premiums so then you're not hit with a big bill if something were to come up. And many of these plans include dental, vision, and hearing. And these are done, these programs and this assistance is available to you at no charge. And it really should be done yearly, especially if your health is changing. Oral health is often overlooked. Something as simple as making sure, even if you don't have dental insurance, try to take a look in your loved one's mouth. Over 25% of people 65 or older don't have their natural teeth. It can relate to problems such as dry mouth, gum disease, and mouth cancers. It's important, if you can, to make those regular dental checkups. But again, it's often difficult because they don't have dental insurance. Substance abuse, typically alcohol or drug related. It's more prevalent among seniors than realized. Physicians, healthcare professionals oftentimes don't ask, and it's often overlooked and missed in medical checkups. Oftentimes, older adults are prescribed multiple prescriptions to be used long term. And substance abuse can result from someone suffering mental deficits, such as dementia or depression, or taking another patient's medications due to the inability to pay for their own.
And Tracey, I mentioned to you that I heard a provider talk about the fact that generally with regular checkups with their primary care physician, monitoring those additional medications that may come from visits to specialists, um, could significantly improve their overall functioning, because they can eliminate some of those medications that are duplicates as such, or that they cause side effects. So it was amazing to me to hear that encouragement again back to the primary care physician, just to make sure that there are not too many medications on board.
Absolutely. And so because of our time right now, I'm actually going to skip ahead a little bit, because I think it's important to kind of talk about a little bit about palliative care. Again, these slides are available to anybody who wishes to have them. Keeping in mind that so it is very important to have a relationship with a primary care provider. But what's also important to recognize is that sometimes when you have all these specialists and people prescribing different multiple medications and prescribing different kind of therapies, we kind of get it, channeled into our one special area. One of the things that can be very important is that preventative care is what we're talking about with chronic illnesses, and curative care, working with, trying to treat hypertension, heart disease, kidney disease, lung disease. Palliative care is a really important role that can accompany that. Palliative care providers can actually come into the home. I'm going to go to the next slide, and talks about that they can come into wherever a patient calls home, and actually be the eyes and ears for that provider that gives kind of a different look than what you were able to see when that patient came into the office for that 15-minute visit. They can pull all the disciplines together and make recommendations. So it's having a palliative care consult or a provider looking at everything for that individual helps give peace of mind for that primary care provider, for that patient, and for those the adult children who might be caring for those loved ones.
So you're saying, Tracey, that it's important for somebody who has a serious illness of any kind to consider the possibility of a palliative care consult. Again, that person can help look at all of the providers, coordinate the care for all the providers that are involved, stay closely involved with the primary care physician, but begin to answer some of those tough questions like, what are our goals of care? What do we want to do? What do we not want to do? Maybe we don't want to go back to the ER if we can absolutely avoid it. So, and I see you brought up our checklist for palliative care consult. It's in two parts, but I'll let you speak to that. It looks like it lists some of the areas where it might be helpful for palliative care consult.
Oftentimes people don't know, how do I call in palliative care? What does that mean? But there can be so many benefits to having a palliative care consult. Again, it's a consultative role. They're not coming in and visiting you on the same level like hospice services would. But again, they're to kind of help coordinate care and help your loved one live the best quality life. So our palliative care trigger tool that we've developed really does talk about, if your loved one has any one or more of these check boxes, that they can be checked and they would absolutely benefit from a palliative care consult. So you can see some of the issues are, serious health problems that require frequent contacts with the physician, or if you're making frequent emergency room visits, side effects of treatments or medications, that you have any questions that might be related to changes in care. If they're having nutritional need changes and you need to talk about that. You as an adult child or any family needs caregiver support. They're having any difficulty with bathing, toileting, meal preparation, unintentional weight loss, any questions about whether or not hospice or palliative care might be appropriate. All of these things would be appropriate for having a palliative care consult, so that you can talk about goals of care, do some advanced care planning so that your loved one can be included in what their wishes are. And we're actually going to skip a little bit ahead to that in just a moment. Hospice care is certainly kind of falls when you're no longer seeking curative treatment. Physician determines that the patient has a life expectancy of 6 months or less if the disease that they're diagnosed with runs its normal course, and that you're choosing not to seek curative or aggressive treatment. I'm going to again skip ahead just a bit because I think some of the most important things that I'd really like to hit on is that as the adult child of an aging parent, please do what needs to be done to take care of you and them. Be actively involved in their medical treatment if at all possible. Know what medications they're taking. Know how to operate any medical equipment. Let your loved one do everything that they can for themselves as long as possible. Help them maintain a healthy diet and exercise program. Talk about advanced directives, most forms, and palliative care. And that's where palliative care can really support you and your loved one. The most important thing as the adult child, take care of yourself. Day-to-day life of a caregiver can be very physically and emotionally draining. Be willing to ask for and accept help. Keep up with your own health and medical appointments. You're not doing anybody good if you fall to the wayside and your adult aging senior needs assistance and there's nobody to care for them. Find time for yourself. Get your hair cut. Go to a movie. Schedule a massage. And find someone you can talk with when things are getting tough. I've listed here also websites that I've used for and resources that I have pulled this information from. So feel free to do that, to use those resources. And then Kevin and I have both listed our phone numbers here and our email addresses. Would love if you have any questions, concerns, thoughts that you'd like to share about your personal experience. We'd be happy to talk with you, specifically talk with you about your personal situations and see if we can offer any assistance to you and any support.
Thank you, Tracey. So I know that we're short on time, but if they have any questions at all, if they would like to talk further about palliative or hospice or any of these conditions, that we'd be happy to consult with them. And Bruce, again, I know we're close on time, but I'm hoping that we might have had some questions in the chat. Do we have some questions for Tracey?
No, I don't think we have any questions, but you all have, thank you so much for kind of shedding some light on the more prevalent diagnosis conditions that affect older adults. And I think you've given us some wonderful guidance for adult children who might start to notice some of these conditions with their parents, and some practical tips on how to address those. So thank you for being with us this evening.
Thank you.
Again, thank you, Kevin Pearce and Tracey Ennis of AuthoraCare for being with us this evening and sharing that great information. Again, special thanks to our sponsor for tonight, Home Instead. We appreciate all of their support and encourage everyone to reach out to Home Instead should you or your family need any non-medical services. Join us again next month, November 18th at 7 p.m. When we'll be with you again. Looking forward to discussing what to look for when visiting mom and dad. I think a very timely message as the holidays approach. Don't forget about our annual symposium. We're excited to have present at the symposium on November 5th, Teepa Snow. So you can register for that presentation on our website, acapcommunity.org. So thanks again for everyone that's joined us this evening and for our presenters. And we look forward to seeing you next month. Thanks for being with us. And good night.
Thank you.